What's up, guys? Low key high yield here to talk to you today about quality improvement for the USMLE. This is going to be short, sweet, and high yield, so let's get to it. First concept you're going to want to be familiar with is measures of healthcare quality, and we'll go through these now. Structural measures have to do with the available resources to an organization, so things like staffing ratios, hospital beds, or crash carts. Process measures have more so to do with the performance or actions of employees in a healthcare system. So, are we giving antibiotics to patients? Are we referring patients to colonoscopies? Outcome measures have to do with patient outcomes. So, the final impact of a healthcare system on patients. These could be things like the number of infections, readmission rates, average patient hemoglobin A1C. Process and outcome measures are confused a lot by students, so make sure that you know the difference between these two. If it has to do with something that an employee is doing, that is a process measure. If it has to do with a patient's final health outcome, that's an outcome measure. Balancing measures have to do with the impact of one system on another. So imagine that there is a clinic and they decide to put AEDs on the walls. You could compare the fiscal cost of these new AEDs with the benefit of how many lives that they're actually going to save. And the last measure is a composite measure. This is exactly what it sounds like, a combination of different measures. So, a lot of hospitals at the end of patient stays like to give out these patient satisfaction surveys, and they combine different measures. So, was your pain adequately controlled? Was your room comfortable? Or your doctor's nice to you, et cetera, et cetera. And what you might be asked on the USMLE is to be given an example of one of these and then just name which kind of measure this is. So be familiar with all of these. Next, we'll talk about principles of HROs, another important concept. Let's define an HRO first. This is a high reliability organization, which is an organization that experiences not a ton of adverse events, even though they work in a high risk, risky environment. For the purposes of the USMLE, you can think of HROs as things like hospitals and clinics, basically anywhere that healthcare is delivered. You can remember these principles of HROs with the mnemonic FSOAR: preoccupation with failure, reluctance to simplify, sensitivity to operations, commitment to resilience, and deference to expertise. Preoccupation with failure just means that employees are always on the lookout for mistakes, no matter how small. So, suppose that there is a nurse who notices a minor medication error. She's going to report that as soon as possible in order to prevent bigger problems down the line. Reluctance to simplify means that employees recognize that errors or problems in a healthcare system are multifactorial. They have a lot of different causes. So, when a root cause analysis is done for an adverse event, rather than blaming one person for a mistake, that would be simplifying, right? You look at all the different causes of that outcome. Next, we'll talk about sensitivity to operations, and this just means paying attention to things in real time. So, people having situational awareness, using common sense, stuff like that. Commitment to resilience is pretty much what it sounds like, being able to adapt and recover quickly from setbacks that happen in a healthcare setting. If a patient were to have a fall, that's an adverse event, right? The team is going to address that situation and then see where can we make changes? Do we need to introduce different training? Do we need different protocols to prevent falls on our unit? You get the gist. Last is deference to expertise. And this is simply letting the most knowledgeable person in the situation lead. In an ICU setting, there may be an attending who actually ends up deferring to the respiratory therapist to adjust ventilator settings because respiratory therapists have a lot of experience with ventilators, right? Next, we'll talk about PDSA and PDCA cycles. These are pretty simple concept. They're just continuous QI processes that are used to test and refine changes in a system. This can be better explained with an example, so we'll go through one now. The plan could be an intervention that increases hand hygiene compliance, so getting more people to wash their hands. The do portion is actually implementing that intervention, so hanging these signs that increase hand hygiene compliance on the doors of rooms in a hospital. The study check portion means that you are actually looking at, did this intervention do anything? Are people washing their hands more? And then the act portion is adjusting your intervention based on the results of the study and check. So, this process means that you're testing small changes to a system, learning from the results, and continuously improving. It's a cycle. Next, we'll go through some charts and diagrams. First is a fishbone diagram. This looks at one problem or error in a system and recognizes the different contributing factors. Also, something cool about this is that it organizes these factors into categories. So it's a really organized way of looking at all of the contributors to one problem. Next, a run chart just tracks quality metrics over time. So you could look at something like surgical site infections in June, July, August, and then you track it with a line like the diagram on the right here. A Pareto chart is kind of like a fishbone diagram in that it shows multiple factors that contribute to a problem. But what is different is that it actually ranks these contributing factors based on how much they contribute to a problem. So it shows you where is the best place to focus your energy in order to target a problem. A scatter plot is probably something that you're familiar with from your college science courses, but you plot x and y variables and you look at all the points on the plot to determine the relationship between those two variables. And last diagram that we'll look at is the driver diagram. Looks at one big goal and then all of the sub goals or action items that need to be taken in order to achieve that goal. These sub goals can also be broken down into their own individual deliverables as many times as you want. You'll also want to know the definition of lean. This is a QI process that focuses on eliminating unnecessary steps in a process. So imagine that there's a triage system in an emergency department, and at one point, a patient sees a nurse, another point, they see a physician. An example of lean would be making sure that the nurse and the physician don't ask a patient the same questions because that's just a waste of everybody's time. A good way to remember the definition of lean is that when somebody gets lean in a weight loss journey, for example, they're trimming unnecessary fat. In QI lean, you are trimming unnecessary steps, unnecessary inefficiencies in a process. You'll also want to know the definition of value. And you want to know this equation on the left here, value equals quality over cost. So we'll go through an example to explain this best. Imagine that there are two clinics. You have these measures of each clinic's hemoglobin A1C, their medication adherence rates, as well as how much they spend per patient per year. So take a second and try to think about which clinic has the better value. Pause the video if you need more time, but it's actually going to be Clinic B. Let's break down why. Clinic A has average hemoglobin A1C for its patients of 6.9%, but Clinic B has 7.1. 6.9, 7.1, these are really similar. And same thing for the med adherence rate, right? 95 versus 93%. I would say these clinics have pretty much the same quality. The cost, on the other hand, is different. There's a difference of $1,500 per patient per year. That's a lot of money. So, to sum this up, Clinic B has better value because despite having similar quality to Clinic A, it has a much lower cost. Let's finish things out by doing a few practice questions. Number one, a clinic monitors whether clinicians document counseling about smoking cessation during patient visits. What kind of quality measure is this an example of? Pause the video if you need more time, but this is a process measure. So remember, guys, anytime it is a healthcare employee doing something, performing some kind of action, that's a process measure. So here the clinicians are documenting counseling about smoking cessation. Documenting is an action, it's a process measure. Next question. A nurse reports that a patient is showing subtle but unusual behavioral changes. In response, the charge nurse immediately escalates the concern to the attending, despite the patient having stable vital signs. Which HRO principle is best demonstrated here? Pause the video if you need more time, but this is sensitivity to operations. The nurse here is paying attention to things as they're unfolding in real time. Even though the patient has stable vital signs, she's using her common sense because the patient is not looking good. So she's having situational awareness. That's what sensitivity to operations is all about. And last question, a hospital's QI team is investigating why there has been a recent increase in medication errors during evening shifts. The team wants to systematically identify and organize all potential root causes to focus their improvement efforts. Which of the following QI tools, charts, or diagrams is most appropriate to use at this stage? Go ahead and pause the video if you need more time, but this is going to be a fishbone diagram. Remember that a fishbone diagram looks at one end problem, end error, and looks at all of the different root causes of a problem while organizing those root causes into categories. And that's exactly what this QI team wants here. That is it for QI for the USMLE. This is my very first video ever, so please, please, please like, subscribe, share with your friends if you found this helpful, and feel free to comment if you have any ideas for future videos. Thank you so much for listening and happy studying.